student nurse today. My name is Ginger. Can I get you to verify your name and your date of birth for me?
Carly Chandler, November 13th, 2002.
Okay. And how are you doing today?
I'm good.
Good. How's your pregnancy going?
It's going good.
Good. How far along are you?
27 weeks, 4 days.
Okay, awesome. How do you feel about this pregnancy?
I'm excited. I'm nervous, but excited.
Okay, that's to be expected. Was this pregnancy planned?
No.
Okay. Do you have plenty of support at home for you while you're pregnant as well as the baby?
Yes.
Okay, awesome. Have you seen a healthcare provider for your pregnancy before this?
Yes.
Okay, awesome. Is this your first pregnancy?
Yes.
Okay. So there's been no prior abortions or miscarriages, correct?
Correct.
Okay. Has your medical provider told you about any health or medical concerns with your current pregnancy, such as high blood pressure, preterm labor, gestational diabetes, or anything like that?
No.
Okay, awesome. When's your next appointment?
August 19th.
Okay, so that's coming up next week. Good. Have you had your weight checked recently?
Yes.
Okay. Well, how much did you weigh before this pregnancy?
156.
Okay, and you're gaining good?
Yes.
Okay. How much weight have you gained?
About 5 to 10 pounds.
Okay. And that's pretty much on track. The goal is to gain anywhere from 15 to 25 since you were at a normal weight for your size before pregnancy. That's what they recommend you gain while you're pregnant. Do you have any health problems or medical conditions not related to pregnancy?
No.
Okay, good. Are you currently taking any prescribed medications, over-the-counter medications, supplements, vitamins, and/or home remedies?
I take prenatal vitamins and I take Tylenol when needed.
Okay. Now, what you'll need to do is if you need to take anything, you need to discuss it with your doctor first. Do not take something without calling your doctor and making sure it's okay first, okay? Do you have any allergies to medications or foods?
No.
Okay. When was your last pap smear?
At my first doctor's appointment.
Okay, and when was that?
The beginning of March.
Okay, so this year, good. When was your last missed period?
Also the beginning of March. I'm thinking around the 3rd.
Okay, so March 3rd, so that would put you being due December 10th. Okay. Have you had any cramping, spotting with this pregnancy?
No.
Okay. Before being pregnant, was your period regular?
Yes.
Okay, so you had a normal 28-day cycle. Okay, good. Have you had any surgeries in the past?
Yes.
Okay, what surgeries did you have?
I had my gallbladder taken out and I had my wisdom teeth taken out.
Okay, when did those happen?
I had my gallbladder taken out last March and my wisdom teeth last July.
Okay. Do you have a history of drug or alcohol abuse?
No.
Good. Do you take any drugs or drink alcohol now?
No.
Okay. Have you ever smoked?
No.
Good. Do you smoke now?
No.
Okay. Because smoking's not good anyway, but when you're smoking while pregnant can lead to a low birth weight baby, preterm labor, lead to all kinds of problems, so let's stay away from that. That's good. Do you exercise on a regular basis?
I walk.
Okay, good. How do you feel when you exercise?
Good, but tired.
Okay. Since you're getting into your 3rd trimester, a good rule of thumb is to make sure that you can carry on a conversation while you're walking, so you don't need to be so out of breath that you can't carry on a conversation. That'll let you know that, hey, this is too much for me, okay? What do you do for work?
Stay at home, soon to be stay at home mom.
Okay, and that's a job. Have you noticed any swelling in your feet, ankles, face, or hands?
I've had some swelling in my feet.
Okay. Is there anything that brings that about, or do you notice that happens at certain times, or?
When I eat salty,
Okay.
a lot of saltiness.
Okay. So let's try to stay away from the saltiness, salty foods. Let's lower our salt. And also, sometimes staying on your feet too long can make your ankles swell. So plan to take breaks. If you're going to be on your feet, a day you've got a lot planned. Plan to take those breaks and get off your feet and elevate your feet, and that'll help with ankle swelling. Are you having any headaches or vision changes?
No.
Awesome. Do you have a history of UTIs?
Yes.
Okay. Since you know all about that, you need to let your doctor know as soon as you think you've got one, that you have one coming on. They're pretty common in pregnancy, but you may be more prone to them now since you're pregnant and you do have a history of UTIs. So just make sure you let your doctor know if you get one of those, okay?
Okay.
Now I would check her blood pressure. I would check her heart rate. I would listen to her chest, check and count her respirations. And then we would lay her flat in the supine position, and I would measure her fundal height to make sure that it corresponds with how many weeks pregnant she is, and we would also listen to the fetal heart rate. Do you have any questions for me?
About the kick count.
Okay.
How that works.
Okay, I'd be glad to explain that to you. So what you'll do is you'll pick a time of day that you're kind of relaxed and kind of chill. So the best time to do it kind of late at night when you can relax and your day's kind of done. Set a timer on your phone or your watch, and every time you feel the baby move, mark it down. So in an hour, you should feel 10 to 20 movements. Now this could be elbows, kicks, just you want to feel the baby move. Start doing that every day. Now if you notice a decrease, you need to call your doctor right away. There's also some other things I want you to be on the lookout. Well, we hope this doesn't happen, but if it does, you need to call your doctor right away, okay?
Okay.
Headache that doesn't ease up or is persistent or severe. Any kind of vision changes, double vision, blurred vision, you need to call your doctor. Swelling of your face or hands. Now, you're gonna have swelling a little bit, but I'm talking about swelling, like you need to call your doctor.
Yeah.
Any kind of vaginal bleeding, you need to let him know, okay? Rapid weight gain, that means from one day to the next you're way bigger.
Yeah.
So you need to call your doctor. Severe pain in your abdomen, any signs of infection, including the UTIs, and that it means other infections as well.
Yeah.
Fever, any kind of redness, like a bug bite, any kind of infection, you need to let your doctor know. Persistent vomiting. If you are vomiting and cannot stop, you need to call your doctor and let him know. Any absence or decrease in fetal movement like we were talking about. So that's the reason why we want to make sure that the baby's moving every day. So when you keep a log on that, you'll notice if there's an absence or a decrease in the fetal movement. Okay? Do you have any more questions for me?
No.
Okay, great. Well, the doctor will be in soon to check you out. And